All right, I guess we're going to go ahead and get started. First of all, I'd like to thank you all for being here this morning. I think this is a great day, and there's a lot for us to look forward to. My name is Kenny Floyd. I am the Director of the Division of Environmental Protection here at the National Institutes of Health. And on behalf of the NIH, I'd like to welcome you here this morning. I guess I'm going to have to change glasses or something, or I'm not going to be able to read anything I wrote. This is a cutting-edge conference that's really focused on health, and it's brought to us by a Health and Buildings Roundtable. This is a roundtable that we established here a few years ago to try to promote this collaboration between the health industry and between practitioners of design. So it's a real opportunity for all of us. So I'd like to thank a lot of people, actually. There have been so many people here that have been involved in getting this together. All of the members of the Health and Buildings Roundtable, a lot of my staff have been involved in this. But especially, I'd like to thank Jim Whitehead and the American College of Sports Medicine for their help in getting this pulled together today for this first event. I hope that this is an annual event after this year, but we'll have to see how we go. So NIH, as many of you probably know, is the largest agency within the Health and Human Services Department. And our mission is to study and improve human health. So we strongly support and participate in gathering more information about the relationship of health and our buildings and health in our communities. And we serve to create workable solutions to improve human health. One of the primary institutes here at the National Institutes of Health is our National Institute of Environmental Health and Sciences, which is located in Research Triangle Park in North Carolina. And they're charged with promoting the health of our communities, our planet, and while performing valuable research to contribute to stronger, healthier relationships between humans and the environment. Now, the NIHS is primarily located in North Carolina, but they work collaboratively with both the Environmental Protection Agency and the other institutes of the National Institutes of Health, working towards overall environmental health and wellness goals. In addition to the daily work that they do, we have several active research protocols that are focusing on developing more information on this relationship with the environment and how sustainability and wellness can improve the effects of elements humans are exposed to on a daily basis. Now, many of these studies indicate that health conditions deal with or are the result of environmental triggers. And there are currently a Healthy Communities study, which is funded by the National Institutes of Health under the National Heart, Lung, and Blood Institute, and also through the Cancer Institute and the Child Health and Human Development Institute, and a few other institutes here at NIH. But the study is looking at how different programs and policies in communities across the United States are related to children's eating and physical activity behaviors and their health. So this is just one of the studies that NIH is performing related to healthier communities. Another study that has been undertaken is on genes, environment, and health initiatives, developing innovative new technologies to measure environmental toxins, dietary intake, and physical activity to determine an individual's biological response to those influences. And they're using new tools of genomics, proteomics, and metabolomics. And the National Heart, Lung, and Blood Institute is spearheading the methods of analysis on gene-environment interactions in complex diseases initiative, affectionately known as GEI. And I believe this program's been ongoing since about 2008. And it's interesting to note that there's a genomics conference going on directly across from us this morning. And we didn't coordinate that, so it's just the luck of the draw here. So many of these studies have indicated that health conditions and initiatives deal with or the result of environmental triggers. And there's currently a healthy community study. I'm reading the same thing over. I apologize. So the goals of today's conference are to identify the aspects of the built environment that are detrimental to human health and to discuss design elements that can support improved human health and to create a foundation for establishing a national agenda for public health research and policy. Now, we hope this event is a beginning, and we hope that this will lead to greater things. One of the goals that we had in putting this together was to bring together the research community with the design community and put our research into the designs that we do today and in the future. We want to improve human health and create a foundation for establishing this new agenda for public health research and policy. So once again, I'd like to thank you all for being here this morning. I'm going to keep my opening remarks very brief. Thank you for being here and look forward to an exciting day. Now, for the next part of our event, I'd like to introduce Charles Bloomberg, who is a architect here with the National Institutes of Health, and he will take us to the next part of the agenda. Charles?